The Psychiatric Association of Jamaica is reporting an increase in mental illness cases. President of the association, Dr. Earl Wright, is calling on persons to protect their mental health during this COVID-19 pandemic. Shamala Pullen tells us more in this evening's health report.
Post-traumatic stress disorder, anxiety, and depression are the main types of mental health disorders persons are developing as a result of COVID-19.
So what's happening now? We are not able to touch our faces. We are not able to hug one another. So there is an increase in the stress hormones that is circulating in the body. And when you have an increase in the stress hormones that's circulating in the body, then you are going to have an increased incidence, increased number of individuals that's going to have depression, anxiety disorder, and just feel out of sorts because you are not in your normal comfort level.
President of the Psychiatric Association of Jamaica and consultant psychiatrist Dr. Earl Wright says doctors are seeing an increase in the number of persons presenting with symptoms of these conditions.
When somebody is becoming depressed or anxious, one of the things they complain about in Jamaica is feeling tired a lot, the lack of energy, not feeling well. They start not moving around as much. They start not talking to you as much. They withdraw and they become more sad. The things that they used to do, they stop doing it. They don't come to the front porch anymore. They stay in the house.
Other signs and symptoms include loss of appetite, irritability, and refusal of the individual to take his or her medications. Dr. Wright says at this time, intervention is critical.
The research in Jamaica shows that when a community health aide goes to the community and talk to a mother who is depressed, that mother tends to get over their depression much more quickly than an individual that don't have anybody to talk to. So we're talking about the community health aide and the community individuals, expanding it to the community individuals that will be able to pick up these symptoms.
Persons are also advised to see their family doctor before the condition worsens. If left untreated, the condition can get worse to the point of suicide. With your health report, I'm Shamala Pullen wishing you good health.